Silence. And then we'll do the Pledge of Allegiance. Thank you. Pledge allegiance
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Roll call, Madam Secretary.
David Ham, Second District Ronald Brewer,
Here.
Third District Charles Brown,
Here.
Fourth District Pete Lindemoller,
Present.
Fifth District Christine Sid,
Here.
Ben Bilski.
Here. Present.
Okay, the minutes were distributed.
Motion approved. Second.
Motion's been made and seconded. Any discussion? All in favor, signify by aye.
Aye.
Opposed? Motion passes 7-0. Awards and resolutions.
Madam President,
Yes, Councilman Brewer.
I have a resolution proclaiming April as Autism Awareness Month and recognizing Logan's Love, Logan Speaks. I have resolution number 25-23. I move to pass it.
Second.
Motion's been moved and seconded. Discussion. The group is here. If you would like to present.
Yes.
All in favor, signify by aye.
Aye.
Opposed? Motion passes.
I have a resolution here at this time, resolution proclaiming April as Autism Awareness Month and recognizing Logan Love, Logan Speaks. Whereas autism spectrum disorder, ADS, is a general term for a group of disorder characterized in difficulty in speaking interaction, verbal and nonverbal communication, and repetitive behavior, and can be associated with intelligence disability, difficulties in motor coordination and attention. And whereas presently, there is no cure for autism, and there's no one cause of autism. And according to the Center of the Disease Control, 1 in 36 children in the U.S. were diagnosed with ADS in 2020, impacting individuals and families sometimes in devastating ways. And whereas the family of the late Logan Brazil, thank you, a dire 10-year-old with ADS is one such family. Logan was tragically killed in an accident on August 27, 2022, after eloping from his home, a fortress with multiple layers of security in places to keep him safe. And whereas, following the tragedy of the outpouring of support to the family from loved ones and community, Logan's mother and others speak. Other supporters stars the grassroots organization Logan's Love. Logan Speaks to raise awareness about ADS. And whereas Logan's Love, Logan Speaks strives along with his community partners to provide enriching experience and vital resources to support individuals and families in the autism and disability community, and advocate for education, first responders, adopters are what we are not in order to promote safety and acceptance in Northwest Indiana and beyond. Whereas World Autism Awareness Day is April 2nd, 2025. Every year, autism organizations around the world celebrate the day where unique fundraisers and organizations rise in this event. Whereas the Lake County is committed to taking steps to raise awareness of autism, and the organization of Lake County, such as Logan Love, Logan Speaks, that work tirelessly every day that this mission. Now, therefore, let it be resolved that the Lake County Council declares April as Autism Awareness Month in Lake County and celebrate World Autism Awareness Day on April 2nd, 2025, as a special opportunity to educate the public about autism and issues within the autism community and recognize Logan Love, Logan Speaks in these efforts. So resolved this 8th day of April 2025, President Christine Sid, Councilman David Ham, Councilman Nehemiah, Councilman Linda Mulder, Councilman Brown, Councilman Ron Brewer, Councilman Ted Bilski, Lake County Council we present this to you today. Yeah, I should.
Brian.
Oh. Thank you.
Council, did you want to stand?
Okay.
Thank you. Thank you. Do you want to say a few words at either one of the mics?
They're ready.
Hi, everybody. My name is Elaine Reyna, and I am part of Logan's Love. And this is just a handful of the people that are dedicating their time and energy to making Northwest Indiana a better space for the autism and disabilities community. And this is Nicole Reveliotis, and this is Logan's mom. And so she'd like to say a few words.
I want to let you guys know that we are so honored to be here today. This is amazing that Lake County is recognizing all the work, love, sweat, and tears we are putting into our organization and the special needs communities. Logan's Love means everything to me. This is me desperately holding on to my sweet son. We started this journey 2.5 years ago and just finished our 3rd annual Easter egg hunt. And I cannot put into words how amazing it was. Each one of our events has surpassed the last one. I keep replaying the Easter egg hunt over and over in my mind and reminiscing on all the smiles that came from the children and parents. It was a perfect, impactful day that truly humbles a person. When we do these events, I see and feel my son there and hear him in all the beautiful sounds. With last year's walk, we were able to continue our goal of supplying Lake County with Ben's Blue bags by giving Lake Station their bags and training. I am very proud to say we were able to bring Project Lifesaver to Dyer. When Dyer's Fire Chief Joe Martin came to us and told us he wanted Dyer to be a Project Lifesaver town, we knew we had to make it happen. Dyer is Logan's hometown, and that gave us so much meaning. We did just that within a couple of months, and now Dyer is able to implement this life-saving device to their most vulnerable residents. We knew this was something needed here in our county, but we never grasped how much until we dived in. Our first goal was to supply Tri-Town with Ben's Blue bags and educating the first responders on how to handle situations with special needs individuals. Before our walk started, we reached that goal and turned it into a countywide initiative. We now added Project Lifesaver to that initiative as well. Having these tools will be huge and impactful for Lake County. We are not stopping there. We will continue setting new goals, giving more all-inclusive events, and pushing to make Lake County one of the best, safest, loving, educated, and inclusive communities to live in for special needs families. We strive to give families opportunities that every neurotypical kid gets to enjoy through our events. Many people don't understand that when one person in a family goes through something like autism, the whole family is affected. I know everybody here knows that I lost my son Logan, but I don't think you guys know 4 months later, I lost my daughter as well from an asthma attack. My daughter was Logan's biggest advocate. And when I do this not only for Logan, I do it for Jasmine as well. I do it in both their names. They keep saying their names. Our walk is August 24th, and I hope you find it in your hearts to join us and walk side by side with us in our journey and show that you support us and support autism. Remember us. Remember Logan. Remember Jazz. Remember our mission and spread love with us. This is for the community. This is for autism, and this is for Logan. Thank you.
All right, thank you, Nicole, for sharing your story with everybody. I just wanted to let everybody know we've been able to put sensory and communication supports as well as training in over 400 first responder vehicles in Lake County so far, and we're not going to stop until they're everywhere. We're also going to continue to work on Project Lifesaver fundraising. But one of our new initiatives is going to involve Logan's sister Jasmine. Our goal for this year is to start a sibling scholarship where we can award an amount to both somebody who's neurodivergent and a sibling who is neurotypical to further their education. And so we have several events coming up. Our biggest fundraiser is our golf outing, which is going to be Friday, June 13th. At Wicker Park. And so we are going to hand out a couple of pamphlets, our business cards that have our website and email. If you are moved by this and you have the availability, we would appreciate any donations. That's how we're able to give back to this community. So great. So thank you so much for honoring us and having us here today. Thank you.
Does anyone on the council have any comments?
Well.
Well, I want to thank you for what you do. I want to thank you for what you do for folks with autism. And that's why we wanted to recognize you today, because bringing those resources to these children and young adults is very important. So thank you so much. Yeah. I have a brother who has autism. A nephew who has autism. And if it wasn't for these resources, he wouldn't be accomplishing the things he's doing today. So thank you so much.
Madam President,
Yes.
just want to share, even with this whole resolution, those that go out to your family, especially with the loss of your daughter also. My wife runs a daycare, and pretty much out of the 12 kids that she have, at least one of those kids normally coming with, been diagnosed with autism. I'm happy to see something like this going forward here. It does change the landscape of parenting. I have seen it firsthand with parents learning how to navigate through this new life with a child with autism. So I would like to get with you afterward. I would like to start off in support of you all with $500 personally myself, to show how I support this 100%. I've been supporting autism since I've been in the city council, and I will continue to support it. But I definitely want to show you that I appreciate everything that you continue to do.
All right. Anyone else? Okay, thank you. Next on the agenda, resolution honoring Maryville High School senior Adrian Pellet. Councilman Bldg.
Madam Chairman, I'd like to make a motion to approve resolution number 2524. And then I'll ask Adrian, his coach and mom, to come up and we'll read it in for the record.
Motion's been made in second. Discussion. All in favor, signify by aye. Aye. Opposed. Motion passes.
Congratulations, man. This is a resolution honoring Maryville High School senior Adrian Pellet, IHSAA state wrestling champion at 165-pound weight division. Whereas students and professional athletes nurtured and trained in Lake County, Indiana, have consistently shown excellence in all sporting endeavors. And Lake County has generously sent forth its spirited and athletic youth to compete with other youth of the state and in every country and nation of this world. And Lake County is justly proud of its sons and daughters who have so willingly taken upon themselves the hardships and disciplines, both physical and mental, with successful participation in sporting events and the demand of such. Whereas Adrian Pellet, a Maryville High School senior with an undefeated season of 45-0, captured the IHSAA State Wrestling Championship 165-pound weight division on February 22nd of 2025 at Gainbridge Fieldhouse in Indianapolis. Now therefore, let it be resolved that the Lake County Council and all citizens of Lake County extend congratulations and praises to Adrian Ellis for capturing first place in the IHSAA State Wrestling Meet 165-pound weight division, that a copy of this resolution be spread on the official record of the Lake County Council and the official copy be delivered to Adrian Pellet, duly adopted by the Lake County Council this 8th day of April, 2025, signed by Council President Christine Sid, Councilman Ham, Niemeyer, Linderbalder, Brown, Brewer, and Ted Bilski. Congratulations.
Thank my parents for me, supporting me along the way. And my coaches for sticking with me and believing in me. And my teammates are not here, but for, helping me train. And it's not a single sport, but you need teammates to go along the way. Thanks for guys, thanks to people.
What's next on your agenda? What's,
Go to college, have fun college,
what are you thinking?
Purdue University.
Oh, Purdue.
Yes.
Well, congratulations again.
Congratulations.
Dad,
Yeah.
Mom, would you like to say anything? Say a few words? He couldn't have got there if it wasn't for you.
Yep.
Proud of his, just his dedication to seeing him throughout the years, being able to take some of the mental struggle the rebuild season. Just like we said, it's not an individual sport, but at the same time, it's an individual sport, because you gotta fight your own inner man in order to push forward. So, congratulations.
True thing. Coach, any words?
Just proud of him.
Yeah.
Just like to thank him for just allowing me to be part of the journey. Just recently, he was the national runner-up at the senior nationals out in Virginia. So he performed really, really well out there. And I'm sure it's gonna do well. It is in the future. So good luck.
Best of luck. Best of luck to all of you. Madam Chair.
Congratulations. Yeah, very proud of you. You make Lake County proud, and keep up the good work. And takes a team, right? So coach, parents, congratulations.
Thank you, guys.
Councilman Niemeyer.
Madam Chair, I move to approve resolution number 25-25.
Support.
Motion's been made. Is there a second? Oh, I'm sorry. Motion's been made and seconded. Discussion? All in favor, signify by aye.
Aye.
Opposed? Motion passes 7-0.
Thank you. I'm happy to read this one. Fine, yeah. The resolution honoring Lowell High School freshman Cameron Hazlett, IHSAA State Wrestling Champion, 285-pound weight division. You're a freshman. You are going to be tough to handle for this state.
Yeah.
Whereas students and professional athletes nurtured and trained in Lake County, Indiana, have consistently shown excellence in all sporting endeavors. And whereas Lake County has generously sent forth its spirited and athletic youth to compete with other youths of this state and every other country and nation of this world, and whereas Lake County is justly proud of its sons and daughters who have so willingly taken upon themselves the hardships and disciplines, both physical and mental, which successful participation in sporting events demand. And whereas Cameron Hazlett, a Lowell High School, well, it says junior here. Are you junior or freshman? Okay. Lowell High School freshman with a 40-1 season captured the IHSAA Wrestling Championship. Who beat you?
The kid I beat 4 times after you.
Good. I'm glad you got me. 285-pound February 22nd, 2025 at Cambridge Fieldhouse in Indianapolis, making history by becoming Indiana's first ever freshman heavyweight champion. Now therefore, let it be resolved that the Lake County Council and all citizens of Lake County extend congratulations and praise to Cameron Hazlett for capturing first place in the IHSAA State Wrestling Meet 285-pound weight division. That a copy of this resolution be spread on the official records of Lake County Council and official copy be delivered to Cameron Hazlett, duly adopted by the Lake County Council on this 8th day of April 2025, signed Christine City President, David Ham, Randy Niemeyer, Pete Linda Mulder, Charlie Brown, Ronald Brewer, and Ted Bilski. Congratulations.
Congratulations.
So I'm going to share just a little, no, it's fine.
Thank you.
I'm going to share just a little anecdote. My wrestling glory was a 5th grade talent show where I played Billy Jack Haynes, the wrestler, and a friend of mine played Don Morocco, the former professional wrestler. We put on a show for a talent show, but it was professional wrestling, scripted in. But I know what you do there. It takes a lot of discipline, a ton of work. And your future is unbelievably bright. And I look forward to someday seeing you hoist a gold medal at some point in the Olympics.
Just want to thank my family, my community, my coaches, and especially my grandpa who's not here today, and also my teammates who pushed me and stand me down on.
Awesome. Coach?
It's an honor to be the coach of a young program and have such talent and the support. I appreciate everything. Thank you.
And Northwest Indiana. Northwest Indiana is becoming the home of incredible wrestling. I went to Hanover Central High School and graduated with a guy named Greg Larson, who was a state champion wrestler. And we've watched Olympians come out of Northwest Indiana here. I was at the gym yesterday and Stevan Micic was on the treadmill next to me, who competed in the Olympics for Serbia out of Cedar Lake. So your future's bright. The radar is on Northwest Indiana in wrestling. So keep working hard. Can't wait to see what you accomplish. Congratulations.
Congratulations. And we're going to correct that in just a few minutes. We're going to give you a new one where it says you're a freshman, not junior. We're going to correct that.
Madam President,
Yes.
I was hoping that we could have Councilman Niemeyer and Cameron give us a demonstration.
Listen, I've learned one thing. Wrestlers are good sportsmen. They're nice people, but they're not to be trifled with. So I'm too old for that kind of a demonstration, Charlie.
Been a good show. Next, we have acknowledgements. Is Jacqueline, are you here? Jacqueline Cavillo? Oh, there she is on that end. Okay.
We usually have a motion.
Yeah, we just need a motion.
Yeah, I'll motion to award Jacqueline Cavillo the Sid Garner Scholarship Award.
Second.
Motion's been made and seconded. All in favor, signify by aye.
Aye.
So passes. I don't really give him the motion.
Take a picture on the front.
Thank you. Thank you. It does, do you have a few words you'd like to say?
She got the, or we got the microphone up there
Yeah.
still?
Either, yeah, it's still there.
Hi, my name's Jacqueline. I am an Indiana University Northwest School of Nursing student. It's taken me an incredibly long time to get here, but thankfully for the solidarity that exists in our community, it's made it possible. So keep sticking together and always reach out to everybody. Thank you.
Yeah, thank you. Thank you. And for those that don't know, Sid Gardner, he was once a councilman here and sitting where we are now. And he established a scholarship, full year for any IU student. Preference does go to a employee of the county or a relative of the employee. Jacqueline did not fit that criteria, but yet we felt it was important to still honor and grant her as a recipient. And we all know there's a shortage of nurses, so thank you for going into that profession. Thank you. Congratulations to you. Okay, now we have the surveyor's office, an acknowledgement. Who's handling, is someone from the surveyor's office here? Okay.
They just know they're the best, that's all.
Yeah, we know they're their best. You want to just read the?
Yeah, Madam Chair, I have a certificate of recognition for Lake County Surveyor in recognition of earning the Certificate of Platinum Achievement from the Indiana Geographic Information Office for outstanding involvement in Phase 1 of the 2025 Indiana Data Harvest, presented on April 8th. So congratulations to our Surveyor's Office.
Congratulations. Yes, we're proud of all the hard work you do. The Lake County Sheriff acknowledgement, we are going to move to the May agenda, as well as the school city of East Chicago. Do we need any type of motion for that? It's just an acknowledgement, not just, but it's an acknowledgement. Okay, next, I'm going to pass the gavel to my Vice President, Councilman Brewer. And I am going to ask Tamara and Alice to come forward. And his parents, or anybody else is with him. Come over here. So this is a certificate of recognition for Cameron Ellis.
Tamarian.
Marion, in honor of your outstanding academic achievement in earning a perfect score of 1,600 on the SAT. Your exceptional dedication, intelligence, and perseverance. Your accomplishments reflect your hard work and commitment to the excellence, bringing great pride to your community, our community. We thank you very much. Lake County Council, Christine Sid, President Dave Camp, Councilman Peatman DeValder, Councilman Ron Brewer, Ted Bldg, Randy Niemeyer, and Charlie Brown this 8th day of April. We are so very proud of you. I know your parents are as well. And Cameron, to Tamarian, that lives in my community in Chicago, and I couldn't be more proud to have you there. And have a few words.
I don't, but my mom probably does.
Here we go. Here we go, Mom.
First of all, thank you so much, Ms. Sid, for the invite. Councilman Sid, for the invite. Yes, we do reside in East Chicago, and Tamarian is just a junior in high school. He is an exceptional student. He also has a diagnosis of autism. He was diagnosed at the age of 8. So I encourage you to continue to keep on keeping on, and things can be done. It's evident.
It's evident.
Also, I'd like to thank my pastor and my first lady, Juanita Hill from New Ebenezer Missionary Baptist Church, for attending this wonderful celebratory event. And thank you to the Lake County.
Study. I hear you went to. Yes. We're proud of you. For you.
See you.
All right, thank you. Picture. Father?
Yes.
Ready.
They have reading now English.
Thank you.
Chris, I didn't know.
Thank you, Esther. Thank you. Yes. We're gonna now take care of our, business agenda. So all those who were recognized and acknowledged today, you're welcome to now exit the meeting. Thank you so much for coming.
Thank you so much.
You're welcome to stay too. It's pretty exciting
Yeah.
stuff.
Our room's gonna be.
We've got a crazy transfer coming up in the.
Thank you.
corner.
Congrats.
Riveting. Good luck, brother.
Congratulations.
Thank you so much, coach.
Now we're left with the vote.
No, absolutely not. And not as much as the next. I noticed that I just. One thing is.
Are you wrestling at Purdue?
Yes.
Big Ten champ future, right?
Did Ronald go?
Yeah, that was such a start. I don't want to get caught. I'm just getting burned.
See the video?
What did he? Oh, yeah. I'm glad I go back. We'd have to sleep. It was, I like that.
All right, we can get started. You'll walk in, unless you guys want to wait for,
It's up to you.
unless it comes to like, I think we're good. Okay, Councilman Ham.
As was stated in the work study session, 5A and B has been withdrawn. In regards to C, I move for approval of a resolution permitting the Lake County Auditor to pay an outstanding 2024 invoice from 2025 budget.
Second.
Motion's been made and seconded. Discussion? All of, roll call, please.
Ham,
Yes.
Brown,
Yes.
Linda Mulder.
Yes.
Yeah.
Meyer,
Yes.
Sid,
Yes, motion passes 6, 1 absent. Coroner's office.
Madam Chair, I move to approve the creation of a new line item, Coroner's Motherhood and Infant Health Initiative Program Grant, SUID SDY Grant Fund 8126-64490, other equipment.
Second.
Motion's been made and seconded. Discussion? Roll call, please.
Brown,
Yes.
Linda Mulder.
Yes.
Yes.
Meyer,
Yes.
Yes.
Sid,
Yes. Motion passes 6, 1 absent.
Madam Chair, I move to approve an appropriation in the Coroner's Motherhood and Infant Health Initiative Program Grant, SUID SDY Grant Fund 8126-64490, other equipment, $2,616.84.
Second.
Motion's been made and seconded. Discussion? Roll call, please.
Linda Mulder.
Yes.
Bldg,
Yes.
Meyer.
Yes.
Yes.
Brown,
Yes.
Sid,
Yes, motion passes 6, 1 absent.
Madam Chair, I move to create a new line item in General Fund 1001 as 63620, equipment repair.
Second.
Motion's been made and seconded. Discussion? Roll call, please.
Bldg,
Yes.
Meyer,
Yes.
Yes.
Brown,
Yes.
Linda Mulder.
Yes.
Sid,
Yes, motion passes 6, 1 absent.
D, Madam Chair, I move to approve a transfer in the General Fund 1001 from 62255 Pathology Supplies, $3,500. 63130 Toxology Lab, $3,000 to 64490 other equipment, $3,500. 63620 equipment repair, $3,000 for a total of $6,500.
Second.
Motion's been made and seconded. Discussion? All in favor signify by aye.
Aye.
Opposed? Motion passes 7-0.
Madam Chair, I move to approve an ordinance on first reading, the ordinance amending the Lake County 2025 salary ordinance, ordinance number 1500F, reorganizing positions, Lake County Coroner's Office, Fund 1001 through 1007.
Second.
Motion's been made and seconded. Discussion?
Discussion.
Yes.
I expressed this in the study session, but wanted to express it again in the public meeting that I am in favor and support the efforts of Mr. Pastrick in reorganizing his department. I think there's good justification for it. I am, however, on the record as saying that I'm not a fan of the mid-year pay raises because everybody else is getting one. So I think we need to curtail that practice here going forward, especially with some of the uncertainty in local government funding. Starting when we get into this budget cycle, people are going to have to get in the habit of making their request at budget time, and no is going to have to become an answer to this. So thank you.
Thank you. Any other comments? Okay, roll call, please.
Seameyer,
Yes.
Yes.
Brewer,
Yes.
Yes.
Lindenmuller.
Yes.
Yes.
Sid,
Yes, motion passes 7-0.
Motion to suspend the rules.
Second.
Motion's been made to suspend with the rules. Roll call, please.
Yes.
Brewer,
Yes.
Yes.
Lindenmuller.
Yes.
Yes.
Seameyer.
Yes.
Yes, motion passes 7-0.
Make a motion to adopt an ordinance on second reading, amending the Lake County 2025 salary ordinance, ordinance number 1500F, reorganizing positions in Lake County Coroner's Office.
Second.
Motion's been made and seconded. Discussion? Roll call, please.
Brewer,
Yes.
Brown,
Yes.
Lindenmuller.
Yes.
Bldg,
Yes.
Seameyer,
Yes.
Yes.
Sid,
Yes, motion passes 7-0. Hobart Township,
Madam Chair, I make a motion to approve, transfer from reassessment in 2015 Fund 1337 from 61100 overtime to other professional services 63190 of $5,000 of the total of $5,000 in the training.
Second.
motion's been made and seconded. Discussion? All in favor signify by aye.
Aye.
Opposed? Motion passes 7-0.
Madam Chair, make a motion for Ross Township Assessor 2005, creation of a new line item, reassessment fund 215, fund 1337, line item 62210, petroleum.
Second.
Motion's been made and seconded. Discussion? Roll call, please.
Brown,
Yes.
Lindenmuller.
Yes.
Yes.
Seameyer,
Yes.
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 Yes, motion passes 7-0.
Madam Chair, I'm going to make a motion to transfer out of reassessment fund 215, fund 1337 from 64440 motor vehicles to 62210 petroleum, $1,000.
Second.
Motion's been made and seconded. Discussion? All in favor signify by aye.
Aye.
Opposed? Motion passes 7-0.
Madam Chair, I move for approval in Department 3002, revised 144 in the general fund effective 4/14 of 25. 12428-013 probation officer currently at $72,828, proposed at $45,548 for a difference of a negative $27,280.
Second.
Motion's been made and seconded. Did you, did you use the effective date?
I did.
Okay, great, thank you. Discussion? Roll call, please.
Yes.
Yes.
Seameyer,
Yes.
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 Madam President, it's so unusual to see reduction as opposed to increase. Could we get an explanation for this?
It's
State mandate.
Yeah, state mandate, it's statutory. This person probably has less tenure, one coming in.
It's what that house did.
Yeah.
You know. But the salaries are set by the state, so we just have to follow the line. And in this case, somebody had retired and he had a younger person.
Boy, oh boy. Yeah, thank you.
That's terrible.
Brown,
Yes.
Sid,
Yes. Motion passes 7-0.
Madam Chair,
Cut it in the middle.
on B, this is an appropriation. We actually took action on this last month, but there was a wrong grant fund number. So I'm just going to repeat this with the correct number. Move for appropriation in Superior Court Criminal Division Safe Grant Fund 9448 or 63190 other professional services in the amount of $24,185.01.
Second.
Motion's been made and seconded. Discussion. Roll call, please.
Yes.
Neemeyer,
Yes.
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 Brown,
Yes.
Lindenmuller,
Yes.
Yes, motion passes 7-0. Councilman Ham.
Madam Chair, in Lake County Superior Court Division Room 1, which is 4002, I move to create a new line item in the supplemental adult probation fund 2143 for part-time.
Second.
Motion's been made and seconded.
I know.
Discussion. Roll call, please.
Neemeyer,
Yes.
Ham,
Yes.
Before,
Yes.
Yes.
Lindenmuller,
Yes.
Yes.
Sid,
Yes, motion passes 7-0.
And move for approval of an appropriation
Second.
in the same fund. How's that?
Second.
What amount?
61190 part-time, $5,000.
Motion's been made and seconded. Discussion. Roll call, please.
Ham,
Yes.
Before,
Yeah.
Brown,
Yes.
Lindenmuller.
Yes.
Yes.
Neemeyer.
Yes.
Sid,
Yes, motion passes 7-0.
Madam Chair, in Lados Division 1, Department 4008, I move for a transfer to Division 1 Lados Funds 4217 from 61120 professionals in the amount of $10,000 to 61190 part-time in the same amount.
Second.
Motion's been made and seconded. Discussion. All in favor, signify by aye.
Aye.
Opposed? Motion passes 7-0.
Thank you. Look at 81.
Thank you.
Yeah, Madam Chair, in Lake County Division Room 3, Department 4004, I move for approval of an ordinance creating the Lake County Superior Court, County Division 3, Veteran Treatment Court, All Rise Mentor Court Network Fund, which is a non-reverting fund.
Second.
Motion's been made and seconded. Discussion. Roll call, please.
Yes.
Yes.
Lindenmuller,
Yes.
Bilski,
Yes.
Neemeyer.
Yes.
Yes.
Sid,
Yes, motion passes 7-0.
Move to suspend the rules.
Second.
Motion's been made and seconded to suspend with the rules. Roll call, please.
Brown,
Yes.
Yes.
Bilski,
Yes.
Neemeyer.
Yes.
Ham,
Yes.
Before,
Yes.
Yes, motion passes 7-0.
Madam Chair, I move for approval on second reading.
Second.
Motion's been made and seconded to approve on second reading. Discussion. Roll call, please.
Yes.
Bilski,
Yes.
Neemeyer,
Yes.
Ham,
Yes.
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 Sid,
Yes, motion passes 7-0.
Madam Chair, in Department 4005, I move for an appropriation in the Family Recovery Work Rent Fund 9345. 61290 supplemental pay, $6,000. 61320 FICA deduction, $459, and 61330 per, $852, for a total appropriation of $7,311.
Second.
Motion's been made and seconded. Discussion. Roll call, please.
Yes.
Neemeyer.
Yes.
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 Lindenmuller.
Yes.
Sid,
Yes, motion passes 7-0.
Chair, I move to create a new line item in Family Recovery Court Rent Fund 9345 for 63920 food and lodging.
Second.
Motion's been made and seconded. Discussion? Roll call, please.
Seameyer,
Yes.
Yeah.
Brewer,
Yes.
Brown,
Yes.
Lindenmuller.
Yes.
Bldg.
Yes.
Sid.
Yes, motion passes 7-0.
Madam Chair, I move for a transfer to the Family Recovery Court Grant Fund 9345 from 63995. Other services and charges, $7,117.81 to 62410 other supplies, $6,117.81, and 63920 food and lodging for 1,000, for a total transfer of $7,117.81.
Second.
Motion's been made and seconded. Discussion? All in favor signify by aye.
Aye.
Opposed? Motion passes 7-0.
Chair, still in juvenile, I move to create a new line item from Lake County Superior Court Juvenile Mental Health Problem Solving Court Grant Fund 9355. 62410 other supplies.
Second.
Motion's been made and seconded. Discussion? Roll call, please.
Ham,
Yeah.
Brewer.
Yes.
Brown,
Yes.
Lindenmuller.
Yes.
Bldg.
Yes.
Seameyer.
Yes.
Yes, motion passes 7-0.
Madam Chair, I move to transfer in the Lake County Superior Court Juvenile Mental Health Problem Solving Court Grant Fund 9355 from 63995 other services and charges, $5,500 to 62410 other supplies in the same amount.
Second.
Motion's been made and seconded. Discussion? All in favor signify by aye.
Aye.
Opposed? Motion passes 7-0.
Madam Chair,
Councilman Ham.
I move for a transfer in the Juvenile Lake County Community Corrections Grant Fund, which is, let's see, 9391 from 63195 contractual services, $5,572. 63232 travel and meals, $150. 63233 travel and lodging, $1,362. 63234 travel, transportation and other, $345. 63235 travel mileage, $1,340. And it goes to 62410 other supplies, $8,769. I so moved.
Second.
Motion's been made and seconded. Discussion? All in favor signify by aye.
Aye.
Opposed? Motion passes 7-0. Right.
Yeah, I have, well, I don't know who's on the grant committee.
We put it now under departments, but
I didn't want to step on anybody's toes.
Councilman Brewer is on the committee as well as Councilman Beekman.
Okay. Grant application, grant approval, and grant oversight committee. Yeah, we have Lake County Hope Court, Indiana Office of Court Services Improvement Grant, fiscal year 26 grant renewal application.
Second.
Motion's been made and seconded. Discussion? All in favor signify by aye.
Aye.
Opposed? Motion passes 7-0.
Lake County Family Recovery Court, Indiana Superior Court Family Recovery Court, fiscal year 26 grant renewal application.
Second.
Motion's been made and second. Discussion? All in favor signify by aye.
Aye.
Opposed? Motion passes 7-0.
Madam President, I move to approve a resolution permitting the Lake County Board of Elections and Registration to pay an outstanding 2022 invoice debt from the 2025 budget.
Second.
Motion's been made and seconded. Any discussion? Roll call, please.
Yes.
Yes.
Lindenmuller.
Yes.
Yes.
Seameyer.
Yes.
Yes.
Sid.
Yes, motion passes 7-0. Thank you. Thank you.
Madam President, I move to approve a planning commission ordinance number 2584, William Rojas, owner and petitioner, 319-2025, B1 to B3. It had received a favorable recommendation with a vote of 5-2.
Second,
Motion's been made and seconded a
Madam-
couple times. Discussion.
Madam Chair, may I ask that the motion and second include the conditions that were spelled out by the Plan Commission, that number one, landscaping and snow removal be the only business, that storage of items related to landscaping and snow removal business exclusively, and any change in the use of property from the above commitments shall require anyone to revisit the B3 General Business Zoning District classification.
Second.
Okay, motion's been made and, well, Pete,
Do you concur with?
yeah.
I concur.
Okay.
Wouldn't that have just been included though as part of that? Because
It's,
in there.
it's important when there are conditional approvals to
Be doing the
zoning,
record.
that it be a part of the public record at the Plan Commission and recommendation and the council at the.
I approve.
Okay. And the second stands?
Yes.
Okay, thank you. For any further discussion? Roll call, please.
Brown.
Yes.
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 Meyer.
Yes.
Yes.
Brewer.
Yes.
Yes, motion passes 7-0. Councilman Brown.
Mr. President, a grant application and grant approval and grant oversight committee fiscal year 26, capital CHIRP grant comprehensive highway injury reduction program. Grant application, I so move.
Second.
Motion's been made and seconded. Discussion? All in favor signify by aye.
Aye.
Opposed? Motion passes 7-0.
Thank you.
Councilman Niemeyer.
Madam Chair, I move to approve a grant application for Oak Savannah Trail Corridor, former Geo Parcel Recreation Development, Delta Institute National Fish and Wildlife Foundation, new grant application.
Second.
Motion's been made and seconded. Discussion? All in favor signify by aye.
Aye.
Opposed? Motion passes 7-0. Councilman Brown.
Madam President, I move for transfer in the health department from 62110 office supplies, $6,043.66. 63232 travel meals, $575. 63233 travel and lodging, $1,500. 63234 transfer / others, $1,000. 63235 travel mileage, $4,700. 64410 furniture and fixtures, $26,000. All of this transferred to 62250 healthcare and lab supplies, $10,743.66. Also 64490 other equipment, $29,104.56, for a total of $39,848.22. I so moved.
Second.
Motion's been made and there's a second. Discussion?
Discussion, Madam Chair.
Yes.
Just for the record, the healthcare lab and supplies and the other equipment, can you give a brief description of what those are?
Sure. Do you wanna look into the?
Yeah, we were discussing about purchasing vaccine coolers. Also cold packs for when you do get vaccinated, everybody needs a cold pack, and first aid kits to distribute between all the pods that we would have.
How many total coolers is that?
6.
And those are pretty expensive.
They are. and they have to be approved by the state before they release any vaccine terms to make sure that they're proper temperature.
Thank you.
Sheila, you also, oh, do we vote on that yet? Yes. Oh, discussion. All in favor signify by aye.
Aye.
Opposed? Motion passes. Sheila, you also wanted to give a little update.
Yeah,
for
quick
us.
update. I've got Michelle here just because she's our HFI manager. And she's been the primary one responsible for doing most of the work prior to me coming on. So Michelle, if you go ahead and just real briefly give them our update.
Sure. Good morning. How are you?
Learning.
So my name's Michelle, HFI project manager. Just to kind of look back, when HFI first came about, they gave each local health department a set of key performance indicators. So that was kind of back in our previous presentations. When coming on board in 2024, we strategically planned what our immediate gaps were in the services that we were providing as a local health department. We worked very closely with Indiana Department of Health so that we can identify through data what our specific needs were. So that helped us in 2025, where the state now recommends that we come forward with our own local health department KPIs. So those are what is specific to our community needs. So on the slides here, we have, we selected 4 local KPIs, and these will be some of our main focus. One is decreasing the rate of mothers not receiving early prenatal care. 2, decrease the count of congenital syphilis from 4 to 0, and decrease the rate of opioid overdose deaths, and increase the rate of children under 3 years of age receiving the recommended vaccinations. So next slide, please. So some of our key accomplishments thus far with HFI is the launch of our mobile health clinic. So we inaugurated our clinic in February. We had a huge event. It was a great turnout. We invited members of the community, our local community organizations, and a lot of our Health First Indiana partners to come. And we've also increased the lead screenings and risk assessments at our local health department. We've implemented our mobile integrated health program, and that is in partnership with St. John Fire Department. We've increased our childhood vaccinations through outreach clinics. So while we will be taking the mobile clinic out in the community, while we just received it, we haven't been, we have still been in the community doing like outreach events and working with community partners and still holding off-site clinics. So with that, we've increased our childhood vaccinations. We've strengthened community partners and expanded school health programs. We've also partnered with the Public Health AmeriCorps, and we are working with an intern who is grant funded with the state. So the state pays her salary full-time for us, and she works in, receives an education award in return. So we have her working on various projects, and I'll expand on those a little bit later. Next slide, please. Oh, you've got it. You've got it. So some of our partners, you'll see total thus far, we've awarded a little over 2.3 million in community partnership grants. And so some of these, you'll see we have a partnership with Purdue Extension, a food bank of Northwest Indiana. And I would like to highlight that the food bank partnership has, if you remember the expansion of their pantry packs. So this is with the maternal infant food packs and mental health packs. We're also installing a overhead locker system at the health department. I'm very excited about this because this will be the 3rd overhead locker system in Lake County, and it is the first past Maryville. So this will be accessible for all of South County as well. And this will be the refrigerated, so they'll be able to pick up their food after hours, but also pick up essential items like feminine hygiene products, diapers, and clothing and such. We have the Franciscan Health, which is helping our prenatal care and helping increase our vaccination efforts with community health workers. Next slide. We've also partnered with the Aliveness Project for infectious disease, Indiana University School of Medicine, who is providing health screenings and referral to care, Geminis Crisis Intervention Team, Safe Coalition for Human Rights, to name a few. Next slide, please. So through all of our efforts over the last year and a half-ish, all eyes are on Lake County. So word is spreading about our programs and the impact that our community partners and our local health department is making throughout the state. So this is very exciting. We were actually invited to showcase Lake County Mobile Integrated Health at Public Health Day at the State House. So Sheila, myself, our school liaisons, and some of our public health nurses, as well as Captain Mike Sharp from Mobile Integrated Health at St. John, went to showcase one of his new trauma kits that he's working on, and also highlight some of the success stories. So what we shared at Public Health Day was a case study that came out of our Mobile Integrated Health program, where one of the participants had a 90% loss of function to the right side due to a stroke. And during a home assessment, the paramedic went in and was able to identify that that participant only had one caregiver, and that caregiver was not able to help lift or lift the participant alone. So through that recommendation, they were able to provide a second caregiver. And this participant had multiple calls for falls and lift assist to 911 and emergency. And with the recommendation, they also installed lift assist. And like I mentioned, provided the second caregiver. The participant has not called 911 for falls or injuries, secondary injuries, in 5 months. So that was really an incredible showcase, and we're very proud to showcase the impact of that program. Also, we've been invited to the IDOH Leadership Symposium to share, and that is with local health departments, basically just showing the leaders in local health departments, and we'll be sharing again our mobile integrated health. White County, we will be attending in May, and we will be workshopping on strategic planning. Next slide, please. So our community outreach and engagement, we have now established an outreach team. So like I mentioned, we have our mobile clinic. So now we have a team that's going to be engaging in our mobile clinic as well as our outreach events. So we'll be supporting community events. We'll be providing the lead testing and immunizations, chronic disease screenings and referral and access to clinical care, as well as education. So with that as well, we'll be focused on our maternal and child health support. So that is going to be a huge piece in our maternal child health plan, which was one of our top priorities at Lake County. Next slide, please. So as you remember, we started digitizing at Lake County. We're now in this century, so we're very excited about that. We are 100% complete in digitizing our food division, and we are just about complete at 90% in our environmental division. We are in the planning phase in our vital records. So these are all of our historic birth and death certificates that are on like aperture cards. So we're working to digitize those. We are now offering online and credit card payments at the health department. We're billing for services for Medicaid and Medicare, as well as looking for food inspection software to improve efficiency and transparency with our food inspectors, and also the software for our grant management. So currently it's just been me grant managing, and so that will help kind of streamline our process and provide some more transparency with our grants and help with review. Next slide. Looking ahead, as I mentioned, maternal child health is one of our top priorities, and we are expanding those health efforts. We're working to build out our aging population program. So this has resulted in a community partnership with the Alzheimer's Association. And so as I mentioned, we have our public health AmeriCorps intern. This is one of the areas where she is now providing Alzheimer's support and caregiver programs free to the community in partnership with the Alzheimer's Association. And then we have a save the date. We are going to be at Hanover High School on August 2nd for our Lake County Family Day. And so this is in hopes that we can provide all kids their vaccines, their health screenings, and hopefully a backpack full of school supplies. We started a school drive. And so we want this to be really a family fun day, get all the kids what they need, but get ready for school, but all ages are welcome. So you'll have insurance navigators there. It's going to be really fantastic. So we hope to see you all there. And then a big part of our looking ahead is our community needs assessment. So as I mentioned, when we came on with 2024 with HFI, we did an internal needs assessment and we identified kind of where we were at up against other local health departments, where we were at with metrics with the state. And so we kind of knew that route, but we didn't hear from our residents and we didn't hear from the community organizations. So that is the next step of what we're going to be doing. And so while I mentioned that we worked really closely with IDOH to get our data and kind of measure where we were headed, we worked closely to identify our jurisdictions. So one of the unique and exciting things with our community needs assessment is that we're doing it within our jurisdiction. So we're working with data processing and partnering with them for our implementation plan as well as our analytics plan. They now have our questions. They're going to be rolling this out and it's going to be an electronic survey. We're doing a two-part community needs assessment. So we'll hear from our organizations as well as the residents. So we really encourage that when we start rolling that out, that we have full, participation. And this will, like I mentioned, give us that unique perspective from our jurisdiction. So while we may collect data from other zip codes that are not within our jurisdictions, we'll forward that information. But this will be the first community needs assessment that is exclusive to our county. As you know, that most assessments either they include Lake and Porter, or Lake has all of the jurisdictions. So this will be unique for us, and this is very exciting. This will also help us kind of fine tune our 2026 and 2027 plans for HFI. So this is okay, so she had, I didn't even look at the presentation, but so we, like I mentioned, we established the framework. We're partnering with data processing. And then we have our HFI committee that we are internally creating to kind of help streamline everything. So do you have any questions?
Any questions, comments?
Madam President, I'd just like to know, do you all do any type of communication with other communities that have health departments? I know a lot of communities are doing away with the health department and it's becoming a county responsibility. So is there any type of relationship there to help just in case another outbreak should break out, that we can coordinate a little bit better and making sure that everyone is vaccinated and whatever needs to be done to the public is taken care of? So is there any type of relationship there with other communities?
Yes, so I know we are unique. I think we're one of two counties in Indiana who still has other local health departments. So we have Gary and East Chicago, who we work very closely with. Like I had mentioned, I imagine that we're going to get much data. Of course, we will support them and give them that data as well from the community needs assessment. But we also work closely with them in other ways too, as well as our neighboring counties. And then just an idea of how we kind of work with other health departments, that leadership symposium, we go to workshops and we're constantly collaborating with other local health departments just to kind of ensure that. Does that answer your question?
Yes.
Okay.
Anyone else?
Madam President, couple things. First of all, thank you for the presentation. I know from the beginning, I was a bit of a stickler for the details on when you get a big pot of money dumped in your lap, right? We've got to really carefully monitor it because we were kind of creating the spending plan as we went along. So I appreciate you organizing this. Job well done with that.
Thank you.
So how are these services advertised is my first question. I don't follow every social media feed there is, but I kind of try to keep my fingers on the pulse, especially in my council district, of what's going on in the various communities. So what sort of avenues are you using to advertise?
So of course, we have social media, but that is a constant trying to increase engagement. I think that our mobile outreach and just being present in the community is really helping us to kind of build up that engagement. But really right now we have our website and then the social media and our engagement efforts.
I'm sure your partners as well.
Yeah.
They get their.
Yes, of course.
Are
Thank
you
you, yes.
using like local government entities, say town and city councils, to try and push some of this out there as well?
I think that's an excellent idea.
Yeah,
I think that's kind of been our next phase, is working on the advertising piece and figuring out the best way to get the word out. You're absolutely right. That is one of our.
I think to achieve your goals, you need as many people understanding the availability of the service so they know they can use it. If it's just a narrow subset of people, we're going to get very narrow results. Other thing is when you provide grants to other agencies, so you received a grant and you're providing a grant through the grant.
Some granting.
Are there conditions, measurables attached to your own issuance of grants?
Yes.
And how do you report those? How do you compile that information?
So, wishing we didn't remove those reports.
I always.
Of the condition of us accepting the funding is that we are constantly reporting data back to IDOH. So she prepares regular reports that report data back to IDOH that say how many of our services we are delivering, the cost of our services. So just this week, you met with the finance analyst with IDOH to put everything within the budget to show where the money went.
Yes.
Anything else you want to add, Melody?
Yes. So with each of the grants that we give out, it's within the contract that they state what their goals are, what their activities are, what their metrics are to help kind of reach those KPIs. And then they report monthly to me. And so what I have them doing in their reports is reporting on quantitative data, qualitative data, and then those metrics that Sheila discussed. So we have those numbers of, numbers of youth provided tobacco prevention, cessation education, for example, would be a metric. So they would include all of those metrics that they put into the contract, as well as their quantitative and qualitative data so that we can evaluate the program and the impact of it.
And as someone who has an autoimmune disorder myself, the more research I've done on some of these things, you find how related it is to our food. And I work in agriculture as well. I'm very encouraged to see an investment and a focus on the food pantry, food access, nutrition. I'm hoping that in tackling some of these chronic health issues, that we take the cue of what's happening nationwide right now of let's focus on preventing the disease or chronic illness from ever happening. And so much of that is through our food supply. So the more investment of those sorts of dollars into the right kinds of food. I mean, I grew up in a family of 5 kids and no fault of my mother's, but we sometimes ate a good bit of processed food because it was quick, right? You have 5 kids. It was 5 kids in 7.5 years. So it was a nut house. And so sometimes it was grab something from the freezer, throw it in the oven, and you got food on the table. As I'm getting into my middle ages now, I am much more conscious and aware of exactly what I'm putting in my body. And I think one of the challenges in treating our health epidemic in this country is focused on that input side of things, because we're either going to eat our food as medicine or we're going to take medicine because of our food. So I'm encouraged by that. I encourage you to continue the investment in that portion of it, because that I think is going to have the biggest broad-ranging impact, is educating people on how to execute a healthy lifestyle with food.
So,
You said something, food is medicine, like there's a program that's called Food is Medicine.
Yeah.
It's been very successful, widely appreciated by those participants. They've learned so much from it. And I'm hoping we can get.
yeah, so actually when we had the partnerships loaded up there, and I went through a brief amount of them, one of them you'll see was Faith CDC. So that's Families Anchored in Total Harmony organization, and they have their Food is Medicine program, and that is one of our partners. So we're very excited to showcase that program as well. That's getting ready to kick off. That was just approved in March. And so that is going to be culturally appropriate, medically tailored food for their participants. And that was a very successful program. So that will be one of our now active programs.
Okay. Thank you for giving me the floor, Madam President.
Anyone else? Councilman Brown?
Mentioned earlier that there are 2 municipalities in Lake County that have their own health departments, Gary and East Chicago.
Yes.
What kind of coordination goes on there as it relates to, even though they have their own health departments, are they aware and participating in the services and programs and grants that are available to the county health department?
So are you referring to the community organizations also with the Health First? So Gary and East Chicago also received their Health First Indiana funds. And so they have awarded out grants as well. And then we have partners that we have that are providing services within our jurisdictions, but they may be located into Gary also or East Chicago and providing services there as well. But what I would do is I would refer them to those local health departments to enhance their initiatives in those regions as well. So if we do have any kind of referral base, we are in communications with them. And then also we're all one county at the end of the day. So we do want to make sure that we are working together. So if there's events that are being held in Gary or East Chicago, or if their health department is coming to, represent in an area in our jurisdictions, we just want to make sure that we're not kind of overlapping our services, but we still want to let the community know that we are there, because there are people from Hammond that will go into East Chicago, and there's people from Maryville that will go into Gary. So we do want to continue to build that cohesiveness with us. So
The grants and support comes from the state.
yes.
Does that also apply to Gary and Hammond, Gary and East Chicago?
Yes.
The grants and resources come through you all to those 2 communities, or go directly from the state to those communities?
So how it works here is the state determines how much funding each of those municipalities receives. Our auditor does receive the full amount, and then they forward those funds on to Gary and East Chicago.
Thank you.
Yeah, and I know there's talk at the state level right now during the legislation to maybe reduce, I don't believe eliminate, but reduce some of the grant funding. So that's a concern. Yes. All right, anyone else? Thank you. Very good.
Thanks.
Next on the agenda, we have a county council. We have an appointment. If someone would make a nomination.
Madam Chair?
Yes.
Yeah, I know that this is your district. You're good with Amy Holmes?
Yes.
Yep.
She was highly recommended to retain her seat from the
I thought
library
so,
as well.
yeah. Are you gonna open up? Nominate?
Yeah, open up nominations for citizens appointment to the library board.
Madam Chair, I nominate Amy Holmes.
Are there any other nominations?
Motion to close nomination.
No other nominations. I hereby appoint Amy Holmes to the library board in the city of White. Okay. We have one last item on our agenda, is a resolution in opposition of Senate Bill 1 provision to eliminate business personal property tax.
Motion.
Motion?
Yes.
Second.
There's been a motion and a second discussion.
Madam Chairman, I don't think we should stop. I'm sorry, go ahead.
Go ahead, Ted.
I don't think they realize what's going on. And Charlie, I was gonna reach out to you, you know, the taxing obsolescence law back in the day when it was House Bill 1001 and they picked out of the air the 1%, 2%, and 3%. And we gave this huge tax break to industry and we put them into 3%. There's supposed to be a threshold. I was told by legislators down there, and I was hoping Mr. Blanchard would be here, and maybe Council Lady Sid, you remember them telling us that they can address that. So instead of them driving their taxes down and our taxes up, as Scott did a great job explaining to me, this needs to be addressed. They need to stop messing with this. We need to put as much pressure on them to say, you know what? Quit trying to destroy everything. For all 92 counties, this isn't just a Lake County thing. This is all 92 counties. And I think we've all read enough. I'm not gonna, toot my trumpet, but I tell you, I'm disgusted with what's going on down there. They're completely wrong. And they have the mechanisms in there to adjust it. Unfortunately, they don't know what the hell they did, so they don't know how to fix it. So I'll leave it at that.
Any other comments?
Yes.
Councilman Mayor.
So as a small business owner, I am in favor of an elimination of business personal property tax, but with a caveat. There always has to be a replacement. I've served in local government for 17 years now and understand that the essential services provided here at the local level are not duplicated at any other level, right? The state government's not coming in to pay your police or firefighters or to fill your potholes or to do any of the other essential services that local government provides. So while in concept, I'm in favor of any kind of tax reform that creates more clarity, less burden of taxation, more accountability in the process. I don't think this bill has gone to the detailed length that, as Scott outlined in his presentations, that it deserves. And I was at the governor's residence last week and mentioned to him that I felt like if you want to do this right, and I said this to him, review the report that our financial director gave your team, work on the fundamentals of the system because it's clear the fundamentals are not correct, and give this thing another year, right? Put a pause on it. If you want to freeze the levy to kind of give everything a chance to catch up, while that's going to cause some pain, it's not insurmountable. We can get by a year on a frozen levy, but it's more difficult when you're creating tax reform to a system that is, as you outlined, imperfect, that needs modernization, that needs rethinking.
Broken.
But yet the property taxpayers have seen, as a result of inflation and other metrics, and as Scott pointed out, the burden shift from commercial to residential because of how assessments are done, which LaTanya could speak quite knowledgeably to. The mathematical equations are broken. And I just want to make sure I made record that I'm not opposed to the reform. I think reform is a healthy thing that we should do probably once every 10 years anyways, is take a look at all of our systems and make sure it matches the current environment and the needs of services to the people. So I'm going to vote against this resolution, but the reason is not because I oppose the opposition of HB1. I don't think it's the whole process lacks detail. Like AIC's approach to some of this stuff and commentary on it is kind of very narrowly focused when this is a really broad issue that we face that needs to be addressed in more of a methodical fashion with more detail. And right now, there's just not enough detail in this resolution, in my opinion, nor is there enough detail in the process of legislating tax reform. So everybody's got to do a heck of a lot more work. And I sure hope that the legislators take their time with this and get it right rather than slap us with something that we're going to be recovering from for the next 5 years on a local government level that creates tremendous hardship for most municipal governments in providing basic services.
Absolutely.
Any other comments, Councilman Brown?
Yes, I heard Councilman Niemeyer indicate that he was at the governor's mansion recently. My 36 years in the legislature, I think there were only two occasions in which I had that opportunity. So I'm interested in knowing how it is that you, as a councilman, got an invite to the governor's mansion. That doesn't have to be done here, but it's elaborate. I would be interested in knowing.
I dropped your name. I know Charlie Brown. No, it was a Republican chairman's reception that the governor was holding there. And again, I take every opportunity I can when I'm in those positions to ask questions. So my questions were, what are we doing, right? And why aren't we focusing on those details?
Yeah, Randy, I appreciate you saying what you said, but I think it's important that we send a message down to them and tell them, no, when they would do it to us. And they did. They froze our levy when we wouldn't pass a county option income tax. So there you have no difference telling us, no, this is wrong, this is hurtful, change it. So I think we have that obligation to the citizens here to speak up and say, no, this is wrong. As a matter of fact, I'm not opposed. I'll be the first one to volunteer. Let's start showing the trend in housing, the system that they're going to pass. I'll use my property taxes as an example, and let's start running an ad in the newspaper every week and showing every citizen out there what the impact of this messing with this is going to be to every homeowner in Lake County or in the other 91 counties. And Dave showed me yours this morning. He showed me yours.
Right. That I respect everybody's opinions on this. I think we're all very similar in that we don't believe that local government is run ineffectively or inefficiently, and that taking a giant chunk out of it is not a way to solve the problem, because the problem, like what the health department presented, there are problems that you can treat the symptoms of it or you can treat the cause. And right now, what they're doing is trying to treat the symptoms, which is the immediate cost increase to the taxpayer, but not looking at what the heck caused it in the first place and how do we adjust those metrics. So I respect that and agree with that.
I'll point out, and this isn't in the resolution that we're saying, but I want to point out that since 22, my taxes at my residence have doubled. And as was pointed out by our financial director, Walmart's has gone down. How is this fair? I'm not complaining about myself, about my own. But how can Walmart's go down and mine double since 22? It's a bunch of BS. And I know how they can fix it. They can borrow Scotch Mall for about a week and they'll get it fixed.
Well, Dave, and Dave, to your point, I own a small business. We have a property, we have buildings. Mine have gone up, right? I'm a small business. I don't get the benefit of these big businesses.
Yeah.
So
I'm not pointing fingers at you.
Yeah, but the small business does get a saving for PTRC credits. It's adopted by a county option income tax, which a small business doesn't pay, but get the advantage of it.
Yes.
So there's things out there to help.
there is.
Madam President.
Yes.
I've talked to a state legislator, and my issue with what they're trying to do right now is, and even talking with Scott, I think somebody came in with a plan. I'm not going to say who, because I don't necessarily know where it came from, that they wanted to do something. And I think they got caught going like, oh, we didn't know what we were talking. And so now they're trying to fix it, and they're just scattershot in this whole thing. The problem that I have, and this is what I had told the legislator, was that I think by what they were trying to do, it's going to force municipalities to put in innkeeper's tax or food and beverage taxes or whatever tax you can think of, which those taxes are never going away. It's like a toll road. Oh, once the road's paid for, we're going to close down the tollway. Right. It's not going to happen. We're just increasing taxes long-term by trying to show a win in the short term. Now, for this resolution that we have in front of us, I'm not for, against, whatever. I think it's a more holistic approach that I have. I'm going to abstain from this, from voting on it, because I'm not for it or against it. I think it's part of a bigger problem that I don't even know how I would write a resolution to send out state, but I have voiced personally to them that I think they're barking up the wrong tree.
Any other comments? I agree with most of the comments made up here. To me, this all started with the campaign promise. And it all sounds good to say, we're going to lower your taxes. But the way they want to lower the taxes is to take from one and put it on another. And that's what they're talking about. The replacement is to increase your income tax if you already have one, or adopt a new tax. So it's just taking your, if they're not getting it from your property taxes, they're gonna get it through income taxes. So, and, yes, and, I don't want to defund any department that we have, especially public safety. So I'm gonna support this bill.
Madam
this
Chair.
Resolution.
And you mentioned income taxes, and this was another part of the conversation I had with some folks downstate is if you went to an income tax as a replacement, there's one community in my district, St. John, that has an extremely high per household median income and about 27,000 people. And you have cities like Gary and East Chicago where that income is about half of what it is, or less than half of what it is in St. John. So then you would basically be punishing the folks in some of these communities with a lower household income, and they wouldn't have the available services, the essential things like public safety. And the communities where people have a higher median household income would have all the means that they need to provide service. It's, to me, again, the basic service of local government. The reason it was created was for public safety. That was the essential core purpose. And if anything out there goes to reduce that ability of local government to provide that essential service, I think it needs to be rethought.
Yeah, I think businesses receive only maybe a 12% increase where homes have 50%, or do I have that close to there? I mean, it's the assessment process, that's the issue.
Mhm.
All right, any other comments? Roll call, please.
Ham.
Yes.
Brewer.
Yes.
Brown.
Yes.
Linda Mulder.
Abstain.
Bilski.
Yes.
Niemeyer.
No.
Sid.
Yes, motion passes 5 yes, 1 abstention and 1 no. All right, now come to our councilman. Anybody have anything they
I
want?
do.
All right.
Madam Chair. It probably couldn't be resolved in 1 year, but as I brought up in the workshop with the supplemental pays,
Mhm.
I think maybe the wisest thing to do is to have Scott work on that and slowly chip away with. Some of these funds are strictly general fund dollars. Some of them are specific grants that have to go specifically for one thing or another. So I'd like to make a motion so that Scott can deal with all bookkeepers in all departments. And they know that Scott has our support. So I make a motion that we support Scott Small working on this project and getting it as much resolution as we can, maybe the first year, second year, third year.
I second that motion, Madam
Motion's
President.
been made and seconded. Discussion?
Does this have any teeth to it, or is this more just kind of?
Councilman Pete, I'd like for the departments to know that Scott's not just going out there and freelancing,
Right.
okay?
Okay.
That he has our support. This is coming from us. So that they don't tell him, Scott, go scratch,
Right.
Madam Chair.
That's my purpose.
Yes.
Take this a step further, Dave. I think it's important when we get into the budget time that, in our various budget committees, we take that active role to not just talk about our support for some of these reform efforts, but we put it into practice when we're adopting the budget and start to move that needle in the right direction. Because again, if we're going to be under a frozen levy or a reform system, we're going to have to get very, very good at what we do here from an efficiency standpoint, and Scott could lead the charge on that easily.
You're right.
Madam President, I would not like to see Scott hanging out there on his own. I think there should be volunteer help from the council itself, that the whole entire county is aware of the fact that this is, as Dave has indicated, this is not just a matter of the pencil pusher wanting to do these things as opposed to having the backing and the support of the council itself. So I would like to amend that to say that along with Scott, there are volunteers from the council itself working on this issue. I have had an interest in this since my day one of this whole issue of supplemental pay and what is this, we know what the intent is, but how can it be better managed and have more transparency?
Any other comments?
I agree with Councilman Brown, but not to get technical, do you want me to withdraw the motion or how do we do that?
No, it's just a matter of, as I stated, that there's an intent and hopefully support that certain council persons are volunteering as well to participate in this endeavor.
I agree. I agree wholeheartedly. And if we could get Scott something in writing, Tom, Ray, somebody, so that he can show the departments, we got his back.
It's a lot of work.
I know, and I don't
And-
expect Scott to finish it
Yeah, I think,
necessarily the first year, because some of these things are gonna be tricky when it comes to grant and so forth. The grants might be very cost specific. They gotta be used for X, Y, and Z.
Right.
Can't throw that in the general fund, but give Scott something to work with.
Madam Chair, can we not hear from the person we are putting this burden on in terms of what kind of support he anticipates from the council and what can be done to even begin this, as Dave said, it's not gonna happen in 1 year.
Correct.
But at least let's put our foot in the door and somewhere else is necessary in getting this done.
yeah, because you have to look at each fund where these supplemental pays are derived from and what the statute itself says on what the use is and if it can be used and what are we asking? Are we asking, what is that person doing to earn this supplemental pay? Are those the questions that we want to ask?
I don't want
And maybe sometime, maybe we need to, and I don't know how you start, but maybe these mid-year supplemental pays, the council should start saying no. Just no, we have a budget time. This is when you request a salary for that position. And I mean, you work 8 hours a day, whatever you're doing, and
that's why I brought up to
you
Dan,
know,
who's been
let's
very
use the
helpful
funds to
in regards to the
offset the
auditor's
general fund,
office, and
if
it
we
was
can. I
withdrawn.
don't know, maybe like if a fee's collected, maybe that fee is for the use of someone doing that work. Okay, so they get paid extra to work just on that. I don't know. It's a lot of work. I think we can start with requesting from the departments. Well, we know what funds, but got to look at the statute and then compare that to who's getting it. Some of these are very, very healthy supplemental pays. I mean, they're up there. And maybe it was agreed upon by this council that at the time, because there's maybe some history, maybe the general fund didn't have $100,000 to pay a salary. So the department head said, okay, well, I have 80 and then I have this fund over here that'll pay 20. Maybe that's the way we bought that person on. So,
I talked to
yeah.
colleague, my chair, my president. If somebody agrees to work and they get supplemental pay from a grant, that grant goes away, so does that pay. It's not like covered somewhere else. I don't want to worry about it. You know,
Yes, I just
we're worried about
typed up a form and at budget time or sometime, or we do it immediately, but it says, if you are receiving supplemental pay or you're hired under a grant and that grant money goes away, or even a fee goes away, you're signing off that you understand that it's gone. It doesn't move to the general fund. It's gone.
I'm with you. So that was my motion. I just want the department heads to know that Scott has our back, and I'd love to hear what Scott's done.
I'd like to get supplemental pay to work on this project.
That was a fantastic response.
Yeah, that's my first.
Well done.
The grant.
We don't have a grant, Scott.
Yeah, darn. No, so there are some low hanging fruit. I mean, there's some obvious ones. There's actually some supplemental positions paid out of the general fund, which seems kind of goofy. So you have a position paid out of the general fund, And then that person's also receiving supplemental pay out of the general fund.
Yeah.
Kind of weird. So
That's gotta be a very small number though, right?
there's like 6 of those, but though, so there's that dynamic. So I think
That's
those
where we
could be
start.
cleaned up pretty quickly. But yeah, I think just going department by department and having the conversations, no different than actually when we had some budget reform in 2023, where we reset and went to more of a zero-based budgeting. Had a small amount of pushback during that experience, but a lot of the departments bought in and moved forward. And I think we can do the same thing with this one, with each conversation. And I think this one might be a little easier than even back in 23, just because I think we've established some trust with the council and the departments, and being consistent and matching the actions and the dialogue along the way. The surveyor is one that I like to use as an example, because he eliminated all of his supplementals. And in fact, he moved a number of his positions, if not, I don't want to say all of them, but a large amount of them into his user fee fund. And I remember when we were having this conversation, so he essentially relieved the entire general fund with his user fee fund. But he said, hey, I'm a little cautious about doing this, because if my fund dries up, I got to move this stuff back to the general fund. And there's a history in Lake County where, you lose positions when you do that. So he's on the leap of faith right now doing that. But I have notes, on every department as we move along. So if we end up in situations like that, at least we can refer back and say, oh yeah, back in 24 or 23, the surveyor moved and relieved the general fund of its burden. So now we need to go back the other way. So I think in the end, it'll be a good project. I think it'll take some time. You're right. I think this first cycle that we move through will.
I heard Councilman say that, and I've said it. I think we all agree on it.
Yeah.
We don't expect anything overnight, but.
Yep.
And Madam Chairman, obviously the hardest part, as all the councilmen understand, is gonna be that a lot of these are not reverting funds too, right?
Yeah.
They're paying something, yeah.
But the amount of, we have about 200 non-levy funds that we operate out of. I really question, do we really need all these funds, or can we eliminate them and just start diverting that money as miscellaneous revenue into the general fund? I think that would be even worth the conversation as well. If it's state statute or grant specific, fine. But anything outside of that, does it even make sense to have its own fund? I'm sure there's some department heads and elected officials that enjoy having their own fund that's protected, but maybe at the same time, we're operating, I think, differently, at least in these last 5 years, than we had 15 and 20 years ago, in terms of, we're in a better financial position as a county. We're more efficient, and we're operating better. We don't have to have those old practices laying around. So maybe we clean up some of the quantity of funds that we have as well.
Great. All right, any further discussion? All in favor, signify by aye.
Aye.
Opposed? Motion passes. Public comment. Anyone wish to speak? Come up to the mic and state your name.
Good morning. My name is Dorian Lynn Patel. I'm from Cherville. I had no intention of speaking today. First of all, I'd like to thank the council for everything you do for Lake County. And the reason I'm here right now, I'd like to give a little personal information about myself. In January, I got a phone call from my place of employment, one of those "are you sitting down" phone calls. And I was told I had an exposure to tuberculosis. So I immediately went for a test. A month later, another test. It was negative. But I asked, I says, well, how did you know I had an exposure? And she says, the patient you took care of, 5 days after you took care of her, she presented to the emergency room with symptoms, and she was tested for tuberculosis. And I was thinking of all the people that probably were exposed by this one patient, probably dozens of people between me coming to where I work and then going to the emergency room. And listening today about the Lake County Board of Health and all the partnerships and collaborations and KPIs, I haven't heard anything about any diseases. We learn nothing about what's going on in Lake County. This is not to be critical, but there are a lot of diseases in Lake County. We're exposed. I am on a direct patient care we're all concerned at the hospital, but when I looked up, I went to the Indiana State Board of Health just to see if the tuberculosis rates were increasing. I don't have any information beyond 2023. And there's no information from the local Lake County Board of Health, what the numbers are. So there's really no information on what's really important as far as health. So I'd like to know, is there a gap? If somebody has a disease, it is reported to the State Board of Health, but does the local Lake County Board of Health get information, and is there a reporting system that's up to date and not a year behind, so we know what's going on? I mean, it's the leading cause of death worldwide if not treated.
Go ahead, Sheila, you can respond.
Just real quick, you are absolutely correct. IDWH is behind on almost all of its reporting metrics because it has to collect the information, analyze the information. So, and that's very common for them to be behind. We do have numbers for our local, and just this last year, she started in November. We did hire an infection preventionist to manage our TV program. So 100%, I think your concerns are valid, and that is something we'll work on.
Okay, do you know how long it would be if I wanted to research this, since I'm still in close patient care? If I wanted to know what's going on in the community, is there a place I can look up online to find out what the trends are? Are they trending upward? Are they staying the same? They have to be trending upward because we've got immigration with no health screenings as people come into the country. We don't know what's going on. So we need to know, especially us in first, ground floor healthcare, what we're up against.
Okay, so I would say I'm happy to take your email information. I can have our director of nursing help give you those numbers directly. We are working on our dashboards locally to get those set up. Right now, IDOH has the most current information other than us local. So you give me your email and we'll send you what we have locally, but we are also working on getting our dashboard updated.
Well, thank you for that information. I do have access to, local information, but I was just surprised that I hear nothing about the actual illnesses and diseases going on in Lake County from the Lake County Board of Health. I do. Thank you for your time.
Any other public comment? Okay, I'll entertain a motion.
Motion to adjourn.
Councilman, are you just visiting us today or? Okay, all right. Well, pleasure to have you here.